welcome or not has today's announcement been amongst doctors?
Unfortunately, it's not been welcome. I think Farah Jamil from BMA GPC Chair Committee has really summarised a lot of the feeling, which is that it feels quite ill-advised and undeliverable. And I'll give you the context for that. So something like a snapshot of 3 million extra appointments sounds great, but GPC 1.3 million appointments a day. So that's no more than about 2.5 working days extra, which is just 1% of the general practice workload. And this is where GPs working harder than really they have before, with the worst recorded numbers of GPs than we ever have. So we're delivering more than we have on pre-pandemic levels. So we don't really need sort of these 2-week targets. It's almost a sense of sort of cracking the whip. Professor Martin Marshall, in his statement about this, has actually pointed out that 85% of GP appointments are seen within 2 weeks, 44% of them in the same day. We GPs are working flat out and really trying their best to deliver their care. So today was really us trying to hear someone that kind of sees that and acknowledges that and actually wants to work with us to produce a workable plan. So real strategy, genuine strategy, not these headline grabbing things that raise expectations that we already can't meet with our patients that are facing, for example, a 7 million backlog and elective care waiting times. It's just awful. GPs, we're losing 314 full-time GPs just in this last year, from August this year to last year. And we're losing more GPs than we can recruit. So all of this access, this increase of access, we do want our digital systems to be improved, our IT systems to improve. We really do need that. But access, we can increase all the access we want, but we need actually the clinicians to be there also to deal with that. And that seems to be lost, and we need that detail. We need to understand exactly what it is that we're being asked, and we don't want to see any more patients that have these raised expectations that then get very disappointed and act out.
Do you feel to an extent that doctors are being demonised here? Statements
Absolutely.
like patients, should get what they expect from GPs, as though you're sort of, holding out on them.
Yeah, I think it is creating this dialogue between doctor and patient. We used to have a very trusting relationship, and it's just causing that division. And it just felt like, I saw sort of an interview, and it just felt almost like, our health secretary is placing herself as saviour to the patients. And it's just a shame that it can't be that she wants to work with the healthcare providers that are also delivering the service that we need, the everyday person needs, and that she needs to sort of, realise her ambitions as well.
Could doctors do more? What could doctors do in order to assist with kind of breaking this backlog and addressing some of the points that Therese Coffey is pointing out or highlighting today?
Yeah, I think there's just been lots of sort of short-term plans, and there just needs to be sustainable plans now. So that's not something that's going to be like a pleasing headline, but it's what's needed. So we need a real focus and commitment to retention. So that's things like the Finance Act amendment, pay restoration, returning 11% of general practice funding from the health budget, IT systems investment, no-fault compensation like they have in New Zealand and Canada, because, if you make a mistake, you're absolutely demonised. And this is in a very intense working environment where risk is very high. And there seems to be this issue with, persecuting and being very punitive, and it doesn't sort of add up with the systems that we're working in at the moment. And there also needs to be a commitment to improving our premises. So all these things, they're very boring. They don't make salacious headlines, but they're absolutely needed. And we need people that are committed and serious about that. And it's just been absolutely astonishing that, you've got the GPC chair and the ERCGP chair coming out saying that they weren't engaged with this announcement. It's not a good start, and I hope to see more and better. So I'm sad to say that I think this announcement has fallen flat on its face, and I think there needs to be a lot more to engage this very low morale population of NHS workers.